This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. The United Kingdom has unveiled a plan on banning a cosmetic surgery called hymenoplasty across the country. The surgery attempts to recreate a woman's hymen, which in some cultures is linked to virginity and has been described as a form of honor-based abuse. The procedure will be criminalized as real virginity testing. Minister for Care and Mental Health, Gerland Kigan, said the government was committed to safeguarding vulnerable women and girls in the country. The procedure recreates a thin membrane known as a hymen, which partially covers the entrance to the vagina. It is often done as a way to repair a hymen. Morocco has inaugurated the construction of a COVID-19 vaccine manufacturing plant in partnership with Swedish firm Recipharm, as the country also announced it would end a flight ban that has been in place since last November. The factory, to be known as Central Pharmatech, will produce vaccines against coronavirus and other diseases, with production expected to reach 116 million units in 2024. The official news agency MAP reports on Thursday. U.S. biotech company Moderna on Wednesday revealed that it has commenced clinical trials of a booster dose of a vaccine designed specifically to fight the Omicron variant of the coronavirus. According to Moderna, the booster, which specifically targets the Omicron strain of the COVID-19, will be assessed as both a third and a fourth dose. It added that the trials will involve a total of 600 adults, half of whom have already received 2 doses of Moderna COVID-19 vaccine at least 6 months ago, and half of whom have received 2 doses plus the previously authorized booster dose. And the experts have confirmed the drug Resistance Malaria in Africa. Malaria kills more than 500,000 people per year, most of them small children. Still between 2000 and 2020, according to the World Health Organization, interventions prevented around 10.6 million malaria deaths, mostly in Africa. But nets and insecticides were responsible for most of the progress, but a fairly large number of lives were also saved by a new kind of anti-malaria treatment, antihistamine-based combination therapies or ACTs that replace older drugs like chloroquine. And Vice President Professor Yemi Osinbajo on Thursday in Abuja swore in the Health Sector Reform Committee 4 months after it was founded by President Muhammadu Buhari. Professor Osinbajo, during the inauguration ceremony, challenged the committee members to deliver a modern, virile and people-centric healthcare system so as to attain the desired change in the nation's health sector. The development was contained in a statement issued and signed by the Senior Special Assistant to the Vice President on Media and Publicity, Laolu Akonde, late Thursday, titled Modern People-Centric Healthcare System, Fundamental to President's Vision for Nigeria's Growth, says Osinbajo. This is TOS Television Network and you're watching Health 54. More stories plus Nigeria's COVID-19 update when we return. Stay with us. Welcome back. You're watching Health 54. Biotech firm Moderna and the International AIDS Vaccine Initiative has commenced the testing in humans of an HIV vaccine which uses messenger RNA technology in the United States of America. It was reported that the phase 1 testing is being carried out among 56 healthy adults who are HIV negative. Despite 4 decades of research, doctors have yet to develop a vaccine to protect people from the virus that causes AIDS, which kills hundreds of thousands of people around the world every year. Nigerian lawmakers on Thursday passed the National Health Emergency Bill, which seeks to deliver a national framework for the curtailing of plagues of infectious diseases in the country. The bill was passed following the receipt of the report of the Committee on Primary Health Care and Communicable Diseases by the Senate. And the Nigeria Center for Disease Control and CDC on Wednesday disclosed that it has activated a national multi-sectoral and multidisciplinary Lassa Fever Emergency Operations Center as part of measures to control the spread of the Lassa fever disease in the country. The development was contained in a statement issued by the Director General of the Nigerian Center for Disease Control and CDC, Dr. Ifedayo Adetifa, on Wednesday. And the Nigerian Center for Disease Control (NCDC) in an update on its official Twitter handle on Friday confirmed the country recorded 87 new cases of the coronavirus on Thursday across 10 states and the Federal Capital Territory. With no fatality recorded on Thursday, the NCDC maintained the country's total death toll from the disease remains 3,134. According to the health agency, the 87 newly confirmed cases increased Nigeria's infection toll to 252,840. The data by the NCDC showed that a total of 228,404 people have been discharged nationwide after the recovery from the virus. The NCDC also added that Delta and Edo State reported a backlog of 9 and 7 cases respectively for January 26, 2022. According to the breakdown of the NCDC data, Lagos State, the epicenter of the disease, reported 25 new cases, followed by Rivers State with 16 cases. The FCT also reported 15 cases, followed by Delta with 9 cases, Edo 7, Gombe 5, and Nasarawa 4 cases. The NCDC data showed that Bauchi reported 3 cases, while Kano, Oyo, and Borno states reported 1 case each. The health agency added that Abia, Plateau, Ekiti, Ogun, Ondo, Osun, and Sokoto reported 0 cases for January 27, 2022. That is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS TV Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and thanks for watching.